Morning, good afternoon, and good evening, everybody. Thank you all so much for joining our second webinar in our Developing Equitable Markets for Menstrual Health Supplies series. This webinar, as you likely know, is focused on enabling the development and adoption of standards for menstrual products in low and middle income countries. And today we'll have some excellent presentations by our colleagues at Menstrual Health Action for Impact, as well as several different guest speakers who are going to speak to the importance of standards and orient everybody to some new resources that we have created. But before we do that, we want to go through a couple of quick logistics. First and foremost, we do have translation available for today's session. We use Wordly, which is an AI translation software that enables translation into over 60 languages. I've just dropped a link in the chat if you are interested in following along via Wordly. All you do to do that is you click into the link, and then when you enter the Wordly platform, it will prompt you to choose which language you would like to follow along in. And then you can either enable captions on your screen, or you can have it play audio to you. If you go with the audio option, we just suggest that you mute the Zoom call so that you're not hearing audio multiple times. Our second logistics piece is if you do have any questions for our speakers or our panelists today, we invite you to put those questions in the chat. I will keep an eye on the chat and then work closely with our presenters to make sure that we're able to answer your questions. And if any questions come up that we are not able to get to, we are happy to send those out in follow-up. So do rest assured we will get to questions if people have them, and we'll make sure that we are able to answer all of those questions. And so before we dive in and hand the microphone to our presenters today, I just wanted to provide some quick framing for why we're all here. I think those of you that are familiar with the Reproductive Health Supplies Coalition and our Menstrual Health Supplies workstream have been following along for several months now on a set of resources that we have been creating for the community, really aimed at overcoming some critical barriers to the development of equitable markets for menstrual health. And there are three different pathways that we outlined to do that. And with some support from RHSC's donors, including the Sanitation and Hygiene Fund, we were able to create a set of resources. And so if you joined us 2 weeks ago, you were there for the launch of this series where we provided a preview to all of the different resources to come. And today is our first deep dive session where we'll really get into the resources and materials developed for menstrual product standards, including context on why standards matter, why they're critical for market development, as well as how to use the advocacy toolkit that our colleagues at Menstrual Health Action for Impact have developed. I don't want to steal the spotlight for too long, so without further ado, I'm going to welcome our colleagues from Menstrual Health Action for Impact, Tanya, Soumya, and Arundhati, and I will hand it over to you. If you have any questions or needs during the webinar, feel free to message me or my colleague on delay. And over to you, MHAi colleagues.
Thank you, Sarah. Thank you so much. Very, very warm welcome to all of you. Thank you for joining us today. I am Soumya. I am the program manager at Menstrual Health Action for Impact. We are a think tank and a strategic consulting organization, and we work basically to advance the health and well-being of girls and women, and we use a menstrual health lens for that. I am joined by two of my colleagues today, Arundhati and Tanya, and together we will be deep diving into the content of two key resources that we have developed with RHSC. Both of these focus on enabling the development and adoption of menstrual product standards in low and middle income countries, which we will be referring to from here on as LMICs. Next slide. So this is the flow of the presentation today. We'll start with some background and the project context, and then we will take you through each of these two resources in detail. Before we begin, we would like to do some audience engagement with you. So I'll request Sarah, can we have the Zoom polls, please? So what you see in front of you, the question on menstrual product standards in your own countries. I'll request you to choose one of these options based on what you know about menstrual product standards within your own countries, whether they exist, whether they are currently being developed, whether you think that there are no menstrual product standards in your country, And if you're not aware about the status of the standards in your country, please choose the last option.
And Samia, just
Um,
let me know when you want me to close the poll and it will pop up for you.
yeah, I think 10 seconds more because I can see that yeah, I think all of them have responded. We can close and can we see
Yes, it should share results.
um, great. I think I can see the result as well. And based on what we have here, about 50% have responded that they do have menstrual product standards in their country. And there is a tie between those who say they are currently being developed, and about 20% have also said that they do not think that menstrual product standards exist in their countries, and remaining do not know about it. That's great. That actually helps us kick us off in this conversation. Can I have the next slide, please? So according to the LEAP report 2024, which was developed by RHSC, about 1.72 billion people who menstruate live in LMICs. And this number is projected to rise to 1.89 billion by 2035. Despite these numbers, a large proportion still lacks access to purpose-made products. And this highlights a clear and urgent need for quality menstrual products in LMICs. However, what we see today is that most countries either have no standards or highly variable standards, either for one or maybe two products. Next slide. So, recognizing this specific need, the Swedish Institute of Standards put forward a request to the ISO Committee of Consumer Policy for a global standards for menstrual products. This led to the establishment of Technical Committee 338, also known as ISO TC 338, in 2022. The scope of this committee includes standardization in the field of menstrual products, covering all products intended for both single and multiple use, regardless of the material. And more importantly, what we'd like to highlight here is that ISO has taken several steps to ensure that these standards reflect the diverse context and realities of the growing LMIC markets, and therefore prioritized encouraging LMIC participation in all its processes. To further this particular objective is where MHAi has taken this project along with RHSC, where we have developed resources to encourage participation of national standard bodies, consumer interest groups, and other menstrual health advocates in the ISO TC 338 processes. And also to encourage them to initiate the process of standardization in their own countries. So the two standards that we have include first the advocacy toolkit for country level stakeholders to advocate for standards and their country participation in ISO TC 338. And second is that we have updated the current menstrual product standard database, which was created by RHSC in 2021. Next slide. The intended audience for both these resources are civil society and development actors, government and policy stakeholders, industry and technical experts, but not limited to these. Not just limited to these stakeholders who are already engaged in the standards process, but the toolkit can be used by other stakeholders also, like consumer experts and small and medium manufacturers and others who usually get left out of the process. Next slide. To create these resources, we have conducted an in-depth review of literature. We did multiple rounds of interviews and also many discussions with diverse and a wide range of stakeholders all across LMICs. We wanted to ensure that there is representation and that there is voices from across the region being recorded and that is reflected well in the toolkit and the database. I would like to now request Arundhati to take you deep dive through the advocacy toolkit. Thank you.
Thanks, Soumya, and welcome everyone. I'm delighted to share the first of the two resources that we'll be presenting in this webinar with you. So if you go to the next slide. So our primary objective in developing this toolkit, as Soumya said, is to enable LMICs to participate in the ISO TC 338 processes, and in doing so, also kind of prepare themselves for the adoption and rollout of harmonized menstrual product standards. Now, the toolkit is relevant for country stakeholders because it helps them understand the relevance and importance of menstrual product standards. So why does this process really matter? The need for global harmonization, in addition to having national standards, the ISO standardization process itself, because we realize that not everyone is familiar with this process, and then also present stakeholders like you and I with very practical tools for how we can enable and engender this participation in country. Go to the next slide, please. So you would see this particular, this map of the world, and this map kind of highlights two important things. So one is that Soumya talked about having 1.72 billion people who menstruate across the world. Here you will see the number of people who menstruate in kind of key regions that we want to get more participation from a country level and from national standards bodies. And for particular, I would like to draw your attention to regions that have significant populations. You see South Asia, East Asia, and the Pacific, Sub-Saharan Africa, they have significant populations. And other countries also have large and growing populations. The second data point that I want to draw your attention to is the percentages that you see in these green boxes. And these percentages represent the proportion of people who have an unmet need for menstrual products. So they do not have sufficient purpose-made products, or that is quality products, to fully meet their menstrual needs. And again, here you see that in some across regions, there is an unmet need, but regions such as Sub-Saharan Africa and South Asia have a very significant, 50 and 61%. So these are pretty significant proportions of people that we're dealing with who do not need. Now, who do not have menstrual products. Now, why is all this important for us to look at? So if we go on to the next slide. So LMICs not only have very large populations of people who menstruate, but we also have amongst the fastest growing population of people who menstruate. In addition to this, while there is an unmet need, we also see that several LMICs across the world also have growing menstrual product markets. There are more manufacturers entering the space. There are different kinds of products that are being available. Now, while this may not be the case across all LMICs, there are certain LMICs where we see this market really come into its own and beginning to develop. And these 2 points together underscore that we do need standards. One, to make sure that quality products are available across the market for everyone who needs them, and also to enable trade. Now, while there is a clear need for standards for menstrual products, not all LMICs, as you've heard, have standards for these products. And there are various reasons that underpin this, from not knowing about the need for menstrual product standards, to unfamiliarity with the process. We've heard about language being a barrier, to even stigma and discrimination that people who menstruate face. That stigma and discrimination can also exist in high levels of government, and that's preventing them from participating in this process for a particular category of products. However, LMIC voices are really critical to the global standards development process, and we need their active participation for several reasons. Reasons that benefit the global processes and also that benefit LMICs. So one is LMIC voices, they inform standards, ensuring that they are contextually relevant, and it also helps LMICs learn from each other, exchange what works and what does not work. And very importantly, for those of us in LMICs, it prepares our governments and other stakeholders to adopt and roll out these standards when they're ready, and to feel that they are relevant for our context. Next slide, please. Yeah. As you heard from Soumya, ISO TC 338, that is the International Organization for Standardization's Technical Committee 338, is currently in the process of developing global standards for menstrual products. And again, just to reiterate and to make sure that these global standards reflect the lived realities and the needs of low and middle income countries and their markets, ISO TC 338 has prioritized encouraging their participation. And as you can see from this map, over the years, this has grown, and currently over 50% of the membership of ISO TC 338 is from LMICs, which is a very encouraging sign. But as you see in the map, the dark blue colored shaded areas are countries that are currently participating in the ISO TC 338, but you also see several light blue and really light blue patches showing that there's still tremendous scope to encourage greater participation from LMIC. So whether that's in Latin America, whether that's in various parts of Africa, as well as the Pacific area, we certainly need to be doing a lot more. The good news is that the ISO TC 338 is working to actively facilitate this kind of participation by supporting actual physical participation from LMICs through twinning agreements, which we can hear more about in just a bit, and even through the capacity building of the national standards body. I want to pause a bit because we have two guest speakers who are joining us for this webinar who can give us a little bit of insight into how these processes work from a national standards body perspective and also from the ISO TC 338 perspective. So I'm going to start off with our first speaker. So if we go to the next slide, we are delighted to welcome Susan here today. Susan Ulomi is a senior standards officer who's joining us from the Tanzania Bureau of Standards. So Susan, thank you so much for joining us this afternoon and welcome. I hope you can hear me, Susan. So if you want to just unmute yourself and say hello, we'll know that you're there.
Hello, good afternoon, good morning.
Good afternoon, Susan. Yes, we can see you and hear you. Welcome.
Thank you.
Susan, we have two questions for you. So one is that since the Tanzania Bureau of Standards is participating in ISO TC 338, we want to hear from you a little bit about what made you decide to participate in this global process and which are the stakeholders or who are the stakeholders that really enabled this effort. Over to you, Susan.
Okay, thank you so much. I was previously introduced. My name is Susan Elisante Ulomi. I'm the Senior Standards Officer from Tanzania Bureau of Standards, and I am the Project Manager for Technical Committee TDC 9, which is under the name of Hospital Textiles. And in this technical committee is where we deal with these healthcare products, hygiene products like diapers and menstrual products. And as we all know that menstruation is just a universal biological reality that every woman and every girl experiences it in their life. And despite of being natural, menstruation is often surrounded by silence, stigma, and inequality. So these menstrual products are just not like luxurious products, but they're essential items that directly affect the health, dignity, and participations, especially of these growing up girls in the society. So going back to the question that what moved TBS to register ourselves to join the ISO TC 338 is because Tanzania, through Tanzania Bureau of Standards, is actively involved in ensuring the quality of menstrual products that complies with standards. And this work, as I mentioned before, is carried out under Hospital Textile Technical Committee in Tanzania. And currently, before joining the ISO TC 338, we had some menstrual products standards. I think we have about 6 of them. We have disposable sanitary pads, we have disposable panty liners, we have reusable sanitary pads, we have menstrual tampons, we have disposable panties, menstrual panties, we call it disposable menstrual panties, and we have reusable menstrual panties. So and we have tried to move to harmonize it in regional level, like for East Africa, we have harmonized the disposable sanitary pads. And currently we are currently harmonizing it in Africa level, that is ARSO, African Regional Standardization Organization. So TBS recognized the importance of menstrual products to protect consumers, improve access, and support local manufacturers. So with this foundation, TBS gladly decided to join the ISO TC 338 because international participation allow us to bring Tanzania and Africa perspective in general into the global conversation. So by engaging us to the ISO level, we ensure that standards reflect diverse reality, affordability, accessibility, and cultural sensitivity, rather being shaped only by high income country. So this is about protecting consumers, empowering our industries, and advancing gender equality worldwide. So the second part of the first question, that is like, which stakeholders enabled Tanzania participation in ISO TC 338? Actually, in most of these low and middle income developed countries, let me speak specifically from Tanzania's perspective, that stakeholders, as TBS, are the one who are trying to influence stakeholders and manufacturers in participating in this development of standards. So in reality, it is TBS alone who have moved itself, because TBS has made a deliberate initiative to participate in every ISO technical committee that is developed standards for products which directly impact the public health, economy, and especially the gender-related issues in Tanzania. So after we have joined, we have now, as TBS, take the initiation in informing the manufacturers and other stakeholders. Yeah. So that's it in Tanzania. That stakeholders, we TBS are the one who are to make the first initiation steps, and then we are the one to influence the stakeholders, the consumer, the manufacturers, and the industries, and sometimes even on calling them to our technical committees. Some of them, for them to participate, we really need to give them some little allowances like transport and something like that. So that is it.
Thank you, Susan. And I think I really appreciate how you link that standards are really relevant for people's health, well-being, economic development, because we don't always see them as being related. So thank you for highlighting that. And very impressive to see that you have standards for the entire range of menstrual products, and that you're informing processes at the regional level. So this is all really great to hear. Susan, just one more question for you, which is that how has ISO TC 338 supported your participation in these global processes? Clearly, you're contributing to it. And how are they kind of supporting you? So, for example, you have a twinning agreement with CIS. So just talk us through that so that others also hear, the various modes by which we can participate.
Wow, thank you so much. First of all, as soon as we have joined, we got the opportunity of being trained by the SIS. And actually, I must agree that it was a great opportunity for TBS, because we had the site visit, we had the face-to-face from the SIS delegates. They visited Tanzania, because actually in Tanzania, we have Tanzania mainland, and we have Zanzibar, and we have TBS, and we have ZBS. So both of us, TBS and ZBS, we had the opportunity of being mentored by the SIS delegates, who are our leading training partners. So these partnerships, we benefited it from on-site meeting and training sessions conducted by our lead partners, as I said, both in Tanzania and Zanzibar. And this session gave us a valuable experience. For example, we had a very shallow experience in good standardization practice, especially in ISO online standard development platforms, like how to comment on standards online, how to submit the comments, how to vote. We always do it just by like experience. Someone is just saying, you just do this, but the SIS delegates coming on site and gave us that training. It was a really advantage to us as TBS and ZBS, and actually they were able to participate in one of our technical committees. They met with our technical committee members, they provide training to them. So it was really helpful, especially in enhancing our standardization procedure practices. So our experts have learned how to draft, review, comment, and standards effectively, which built our confidence and technical capacity to contribute meaningfully in ISO TC 338. So actually, the training now, as for us, the training arrangement was the one which has opened the door for us to secure the ISO sponsorship, which allowed not only TBS staffs, but even some of our technical committee members and even the delegates from ZBS, we were allowed to attend the key international events. For example, we are able to participate in the ISO TC 338 plenary in Ghana, where we engage directly with other global experts, shared Tanzania perspectives, and ensured our voice were heard in shaping standards for menstrual products. Yeah, that is it. So these opportunities have really transformed our role. With SAS as our leading partner, we moved from being passive recipients of standards to active contributors. And now we have the skills, we have the confidence and international presence to influence standards that directly affect the women and girls in Tanzania.
Thank you so much, Susan. And I think I see there are other standards bodies that are present in the audience. So if you want to know more about this training agreement, you should reach out to Susan and hear more about the benefits that have accrued. So thank you, Susan, for sharing your experience, and we look forward to hearing more about how TBS is moving forward with this.
Next, thank you so much.
Yeah, thanks, Susan. Next, delighted to welcome Yara Masi Larson, who is the chairperson for ISO TC 338. And Yara, you've been engaged in this process from the very beginning. And over the years, since 2021, you've also seen engagement of LMICs kind of steadily grow. So talk us through about your reflections on this. How has the greater involvement, engagement of LMICs, what has it brought to the ISO TC 338 processes as you're developing these harmonized global standards? Over to you, Yara.
Thank you so much, and thank you for hosting this. So just to give you a little bit of background, I've been working in menstrual health since 2012 and been working across the globe as a co-founder of the Case for Her. That's an investment portfolio focused on the issues of women's health. So when we first set out to create the ISO TC 338 and it was established in 2022, one of our earliest and most important conversations, I would say, was whose reality are we standardizing for? So menstrual products are used across every country, every income level, every climate. Menstrual products are used on average 6 to 8 years during a lifespan. So it's of highly importance. But historically, international standards, as you mentioned before, have been shaped predominantly by high-income countries, and laboratories, infrastructure, regulation systems look very different and what exists in the LMICs, which we found very important, of course. So, for example, I would say that our experts in South Asia has brought us a lot of data on product categories most used in their markets and local standards and how it's been used, and many of which weren't on our initial radar. And some of the African national standard bodies brought to our attention questions about testing infrastructure and can this parameter actually be measured with what laboratories we have in our region and what we have access to. And these are exactly the kind of questions that determines whether a global standard or a standard actually gets adopted or become, collecting dust sitting on a shelf. And LMIC experts have also been critical, I would say most definitely critical, on the cultural and social dimensions. And while these aren't technical questions, they are invaluable when we set up a standard and talk about how to use them, because they carry enormous weight in its context on its own. And as you said today, 54% of our members are LMICs, but that's not just a diversity statistic. For us, it's a quality signal. That means that we will actually have what we call internally a truly global standard coming out of this. But we still have more to do, and I can say with confidence that ISO TC 338 work is now richer and more rigorous and more globally relevant, but there's a lot of countries still missing, and we would love to see more of you joining.
Thanks, Yada. And I love what you said, whose reality are we standardizing for? How true. So Yada, a follow-up question. As ISO TC 338 is quite along in that process, but there's still scope for participation. In our audience today, we have several advocates. What is your call or your message to them to kind of mobilize other stakeholders, especially their national standards bodies, to participate in the process if they are not participating? Especially if they're not participating, and if they are, to strengthen that participation.
For sure. And even though we've been working on this since 2022, there's a lot left to be done, and everyone can still contribute. And I really want to be direct about this question on timing, because it matters enormously, and we are writing the standards as we speak. So the technical working groups are actively debating all the parameters. But once the standards are published, the core decisions are already made. So countries that are at the table right now are shaping them. So this is I would say a once in a generation opportunity, to participate. And so why is it important to participate, one might ask. And I mean, I think there's hundreds of reasons out there, but I'd like to just focus on 3 of them. And the first one is, of course, market access and global harmonized standards, lower trade barriers, and create a level playing field. And countries with their own strong national standards aligned with the ISO framework. So even though if you have the standards, it's really interesting to get engaged, are better positioned, we think, moving forward to protect their consumers and also grow their domestic industries. So second one is consumer protection. And right now, the data shows that many LMIC countries and the countries across the globe have either no standard or menstrual products, or standards that only cover very few of them, as you said in the beginning. And this means that women and girls are using products with no guaranteed baseline today, and the standards can change that. And of course, third is influence. And I think countries that are participating in shaping what the standards say, they will decide about the testing methods, it's the requirement, but you also participate in a lot of discussions around labeling or disposal or other things that are really important. And all of this will have influence and real consequences for every manufacturer, every regulator or consumer in your country, and it might affect it for decades. So it's really about getting engaged now. So I would say that here is my ask, and to be as concrete as possible. Find out whether your country is currently participating or is a observing member in the ISO TC 338. If you don't know, you contact your national standards body and they will know. Then find out if who your country's delegate is and whether you can join with support. And if you are a national standards body and not yet engaged at all, the most important conversation you can have this week is to get engaged. And this advocacy toolkit that's presented today will give you all the arguments and help you to build your case on why to get engaged. And I would just say that there is also, to Susanne's comment, there are more possibilities to twin with the Swedish National or Standard Institute, and we would love to see more people joining. There's also possibilities to get support to participate in in-person meetings and other things. So we're really here to support you to engage and strengthen your capacity and build a stronger group altogether. So yeah, I said it several times, but I'll end with saying it again. The standards are being written right now, so make sure your country has a seat at the table and that your voice is being heard.
Thank you, Yada. I think that was a very clear call. So if we go to the next slide, Sarah. So as Yada says, the time is now, the opportunity is now. And so we do call upon all of you, if your country is already participating and your NSP is engaged with ISO TC 338, it's an opportunity to further strengthen that participation. And if your country doesn't have standards or has standards but is not participating, as Yada says, let's figure out how to do that now, this week itself. And the toolkit will showcase some of the ways by which we can do this. So if we go to the next slide, so the toolkit highlights kind of 4 strategies that we think that countries and stakeholders in countries can adopt to enable this kind of participation. So if we go to the next slide, you'll see our very first strategy, which is going to take a step back and very quickly understand what the market structure or the market landscape is in the country, as well as what's the current status of standards. So you'll see here that when we talk about the market landscape, it's what's the market size, who are the manufacturers, what are the products that are available, what are the supply chains, etc. And for the status of standards, it's to kind of, the toolkit provides you with a very simple tool that will help you identify whether your country has standards or not, for which particular products the standards exist, and what is the level of the national standards body's engagement in ISO TC 338. So it'll help you assess that. And we have a number of practical tools that can guide you in this process that are included in the toolkit, including a very simple market mapping template. It's not super intense or detailed, but something that all of us can use, even if we're not engaged in this kind of market development work. It also has links to the standards database, which you'll hear a bit more about in a bit, a checklist for NSB engagement, and also a country standard status framework. So all of that exists for you to access. And we'll be putting the link to the toolkit in the chat box as well. So if we go to the next slide, so Yada spoke to this a little bit, but it's also important for us to understand how can stakeholders really engage with this process that's happening at ISO TC 338. So you'll see that there are the blue boxes on the left, and I'll start with that. So one is that there is engagement through your national standards bodies, or NSP as we have that. So there are a number of related technical committees who bring a lot of technical expertise into this. And then you have something called the National Mirror Committee, or the NMC, as you see here. And that's actually the primary committee at a country level that contributes to the global ISO TC 338 processes. And it comprises of government representatives, technical experts, manufacturers, and even civil society advocates who are selected or appointed by the NSP following their own country level processes. Now, if you move below, at a global level, you have the ISO TC 338, which comprises of members from these NMCs across countries. And the ISO TC 338 is housed under the ISO, the International Organization for Standardization. And on the right, you see there are these green colored boxes. So what happens if you are an individual advocate or an individual expert who is in this audience? How do you engage with this process if you're not already sitting these committees and in these groups. So the first thing, as again what Yata said, you approach your national standards body and you ask to be nominated into the National Mirror Committee and to provide that kind of technical expertise. And if you are in the NMC, then you have a chance or an opportunity to be nominated to be a part of the ISO TC 338. And once you are a part of ISO TC 338 at that global level, you can be a part of various working groups and task groups. You will have a lot of documents to review, to comment on, to reflect on, and kind of engage with other members of the ISO TC 338 who are representing different countries. The National Mirror Committee and the National Standards Body also takes inputs from other technical experts who may or may not be directly engaged with these processes and feed into these global processes. So there are various ways in which you can engage through these kind of more formal channels. But several of us who are in the audience may not directly be engaging with our NMCs and in ISO TC 338. But this does not mean that there is no role for you. In fact, you have a really important role. And that role comes from convening and bringing together other stakeholders and a variety of stakeholders who can provide technical inputs as well as consumer-facing inputs into these processes. And so you see on your right that there are a number of stakeholders that especially country-level advocates can engage with and the kinds of inputs that they can receive. What we've done in the toolkit is we've provided a list of each of these stakeholders, but we've also specified what is the kind of unique inputs or kind of the expertise that we can draw upon from each of these stakeholder categories. And you as an advocate can bring these folks together to do this. We've also included some short case studies of how advocates have played this convening role and how that has played out. So you see an example that's laid out for you here, and there are more examples in the toolkit as well. Now I want to pause here again. We have someone who has joined us from Sri Lanka. There's Selina Perez. So Selina is she is from Sri Lanka. She is a lawyer. She runs her own social enterprise, and she's also deeply engaged in policy work in Sri Lanka. And she runs Celine Group and Femcare, which is the company that makes reusable menstrual products in Sri Lanka. So welcome, Selina. Hopefully we can hear you and see you, and give us a moment.
Yes.
We'll also spotlight you. So Selina, based on this conversation that we're having on stakeholder engagement and the importance of it, you have really drilled down into engaging with stakeholders across Sri Lanka. Tell us, how has being a social entrepreneur yourself and running a company, how has that helped you in this process of engaging with various stakeholders, and what are some of the challenges that you've faced?
Yeah, thank you, Arundhati, and glad to be here. So I think let me just start by saying my first intervention to answer your question could be very specific to my case, but maybe there's some inspiration that can be had from that. So as per kind of the introduction you gave to me, being part of a legacy operation that has been running in Sri Lanka for 35 years, an impact enterprise with a lot of credibility and trust, has really helped us pivot into the menstrual care space. So like I said, that could be very specific to us, but I think the lesson here is in that engagement, one of the challenges, and in my case, the opportunity has been that there is credibility and trust for what we are doing in Sri Lanka. So starting from that, I also realized as we were going along our journey that being kind of from the handicraft toy manufacturing space, we also had to almost rebrand ourselves into Femcare Private Limited, like Femcare as a brand, because there is a kind of a perception that when you're a social enterprise or even an SME, that products that are made within these groups are of less quality, are not standardized, made in homes. And that I felt from the very start was a challenge to promoting a menstrual product. So we immediately kind of rebranded within the subsidiary. We called ourselves FemCare and really positioned ourselves as an organization that was committed to quality, committed to innovation. And we feel the kind of positive impact of that rebranding and repositioning as we go along. So I think just to summarize on that question, and because what I mentioned to you right now is a very specific case and it's not an equitable case. Celine and FemCare's journey is very much our own. But if you are to really promote reusable product manufacturers, those from the SME sector especially, it is absolute, and this is where the standard plays, because it evens the playing field. It allows SMEs to create quality product. It allows SMEs to have that credibility and trust outside a self-built ecosystem, because you have to be equitable in the way that we promote manufacturers in this space and we promote SMEs in this space. So that's kind of how I want to approach that question, Arundhati.
Thanks, Selena. Selena, very quickly, are there any other stakeholders in addition, apart and beyond from government, who you feel that you need to engage as you're moving along in this process? Any reflections on that?
Yeah, absolutely. And I think here is where the structure of the working group of the Sri Lanka Standard Institute, the one that is in the process of creating the reusable pad standard, is, I think, a good lesson to be learned. I don't know if this is the case across the world, but we engaged with doctors and the medical community right from the start. So other than the technical experts and the manufacturers around the table, having the insights from the doctors right from the very start allowed us to interact with some of the user mentality. So especially in Sri Lanka, and I think this is very much the case perhaps in a lot of LMICs, doctors play a critical role in changing perceptions and giving that credibility to a new product. So, and in the case of reusables, we do compare ourselves to disposables, but it's a completely new category. It's a new product that's going into market. So engaging the doctors within a working group level, I think it's critical. It didn't go too well for us in Sri Lanka because the process is extended because of the various concerns that they are having, which now has led to us having to do research and market surveillance and even mentions of clinical trials. But I choose to look at it positively because you are eradicating concerns a consumer would have right at the start. And therefore, it makes the standard all the more credible. And this is, I think, a very key insight from the Sri Lankan process.
Thanks, Selena. And I think there'll be people in our audience who want to know more about that. So please do contact Selena on chat if you want to take this conversation forward. Okay, so moving on, our third kind of strategy for supporting and enabling NSP's participation in ISO TC 338 is we've got the kind of three sub-strategies. You can have media engagement strategies, and we have some suggested tools in our toolkit. We can also engage government stakeholders directly, and we've had some excellent examples of how you can have a champion ministry or a department within who really advocates for standards. And another way to support the national standards body is by providing technical inputs to the standards process itself, collating and synthesizing inputs from various stakeholder consultations, etc. We also have, again, as I said, we've got lots of case studies that we've included in the toolkit to bring this alive and not just be guidance, but to showcase how countries have done this. We also have, very importantly, as someone had pointed out, we have a making the case template. So if you are working with a national standards body that is yet to engage, you can use a ready-made template and just put in your country data to make the case for such engagement. Next slide, please. And this is actually our last strategy is, while, as Yata said, the standards are being written right now and they will be finalized in 2027. Now, while that may seem like a year away, it is really important for all stakeholders to start thinking and planning for adoption and rollout right now. And in the toolkit, we actually outline several key activities and actions that need to be taken to enable that process of adoption and rollout. So we've listed some of those key actions right here on the slide, but they are fleshed out in the toolkit. And again, we've got examples of some NSBs and some countries who have begun to operationalize some of these adoption and rollout processes. And to hear directly from someone who's already thinking about adoption and rollout is Dr. J.K. Gupta, who's joining us from the Bureau of Indian Standards. He's the head of the textiles department that's leading the process in India. So Dr. Gupta, welcome.
Thank you. Hello.
Dr. Gupta, yeah, thank you so much for joining us. So Dr. Gupta, a question to you is, and it's an important one because there are others in this room who have standards, and India already has standards for menstrual products. What does it mean for us if you have standards but are participating in this process? And how will the new global standards kind of affect what we already have in the country? So can you speak to that?
Thank you. So hello everyone. And just for the information, India is actually having a very big lead role in the development of these important standards, actually for those global standards. And Anuriti, what I foresee, we already have a very well-placed system of adoptions of the ISO standards. If you know, there are two type of adoptions which are available. We can have the identical adoptions, and then as per the ISO template, these global standard can be adopted with the deviations actually depending upon your national needs. So as India is taking a lead role, so in this the process is very well defined, and we once this standard is coming out, we are definitely going to take a look through our sectional committees, and we'll take a call how we can actually globally align our this menstrual product standard. Only one hurdle I foresee, because at presently we are developing two standards. One is on terminology, I will be very happy to align it, and the second is the journal and the safety requirement. And the only missing thing will be the performance requirement at the moment, because apart from the safety and the journal requirement, the absorptions and leakage etc. are other important performance requirement which the ISO is going to we are going to take this subject very shortly. So that is going to be the only hurdle. So we intend to do this in that way ki we'll have the different performance standard for maybe reusable and single use for external and both internal, and then we can give the reference of this ISO standard so that we'll follow all the global benchmark for the safety. So that is the thing, and we have the technical expert committee on that. And as I am heading the whole of this ecosystem, and so we definitely for the market assess, for the level playing field, we'll definitely do this exercise once these standards are out.
Thank you, Dr. Gupta. Dr. Gupta, one more question for you. That India does have technical capacity. We have labs, we have testing facilities. So what kind of capacity building support or technology transfer support can we provide other low and middle income countries that may lack these facilities, which are absolutely essential for standards adoption and rollout?
I think this is a very good question, Anuriti, you've asked actually. Just I give you, we have a National Institute of Training and Standardization. This is called NITS. And since 1968, actually, we are doing a great amount of work for the capacity building of the South African countries, Asia, and I am happy to announce about 100 programs on how you can engage at ISO IC level, on standardization and conformity assessment, on ISOs. We have already organized, and almost 2,000 of those experts has been trained at India since 1968, and most of them are holding the very senior positions now in their national NSBs. So what we can do, I can use that platform. This is called ITB, the International Training Program. So it is being held every year, and where and about from more than 100 countries the participant has attended. So this is what we can do. we can actually, maybe I can invite maybe few of you also to actually give some presentations or lectures during those ITPs, and we can develop the capacity building at that level. And the second is we have a SARSO, that is that is the South Asian this organization. There are 7 8 countries. The Selena is the Sri Lanka is a part of that also. So that SARSO, there is a committee STC4, which is on this jute, textiles, and leather. And in the scope of the work, this medical textile is also one of the area where we can harmonize the standard in the SARSO region. So it will definitely help at through ITPs and the SARSO. This could be very effective too, tools to take these things forward for the capacity building and for enabling the LMICs for the harmonization, for adoption of these standards. Thank you, Anuruddhi. Over to you.
Thank you so much, Dr. Gupta, for joining us on that. And again, if anyone in the audience is interested to know more and to avail of this kind of technical capacity building support, please do reach out to Dr. Gupta on the chat to learn more. Okay, so just in the interest of time, we know that we're almost coming to an end, but if it's okay with everyone, we'll just go on for another 10 minutes. So please do bear with us. So again, a big call out to everyone in the audience. Please do, kind of assess your country's engagement in ISO TC 338 and support that engagement. Use this toolkit. It is currently uploaded and available in English, and translated versions in French, Spanish, and Portuguese will be available shortly. And the MHAi team and RHSC teams are available to provide any further support for this. Now, with this, I hand over to Tanya, my colleague, to take us to our next resource that we've developed. Tanya, over to you.
Thank you, Arundhati. And thank you to all of our speakers. I think it was so interesting to hear about, what the experience has been and also what the opportunities are, because I think regional harmonization and regional cooperation is the way to go if we want to, work on this together and make this happen. So with that, I want to present the Menstrual Product Standards database to you. This work essentially builds on work that RHSC had already done in 2021, where a database of standards for single-use and multiple-use sanitary pads was created for LMICs and some high-income countries as well. The update that we have done for 2026 now includes additional products, tampons, cups, and period underwear. It also will have a much more user-friendly interface that allows for comparison analysis across different standards, and we've taken a lot of user insights to help contribute to that. The database is still getting ready. RHSC is in the process of creating the website, but today I want to share some of the insights that we got from the data with you. But before that, just to give you a snapshot of what have we captured in the database. So we have two buckets of information that we've captured. One is administrative information. So, who's created the standard, what's the year of publication, when was it revised, but also more importantly, the accessibility, what's the language, whether it's behind a paywall or publicly available, whether the standard is enforced through a regulatory reform or not, because typically they have to be. And then on the technical information, there are parameters for physical safety, for microbiological safety, for performance, for material safety, and also packaging, labeling, sampling. All of the parameters that are under consideration by ISO TC 338 as well. Here's just an example, but I'm going to just go over this. But just to highlight that because many of these standards are behind paywalls, we do not have the consent to, give, say, actual test limits or test methods. So we've included binary information. So whether that parameter exists in the standard or not, but you will have access to the source URL or the contact of the NSB to go back to and access that document or more information on it if you are interested. But just to share again a few insights from what we are seeing across standards. So between 2022 and 2026, almost the countries that have standards have remained the same. There's only one additional country, which is an LMIC. But what has increased is that most countries that had standards have, or many of them have created a second standard. So mostly, countries have started with a standard for single-use pads, and they have added either one for reusable pads or for menstrual cups or another reusable product, which is again a sign of how the industry is transforming. And most of this change is coming from LMICs as well. So if you see, 8 LMICs had more than one standard in 2022. And today that number is 16 out of the 18 countries that have more than one standard. And today there are 48 standards that exist. The key point to take away from this, I think, is that a large number of this is from LMICs. And so it's so important that all of these countries are on the table and contribute their expertise and knowledge of having developed these standards to the conversation, because without that, we are basically going blind. In terms of products that have standards, most countries started with single-use pads, so that's where the largest number of standards exist. But we've also seen an increase in multiple-use pads. We also have tampon standards now and cup standards. Southern and Eastern Africa have been very progressive. A few countries like Tanzania, Uganda, Kenya, South Africa have been contributing to the development of some of these standards. So there's a lot of work that's happening in the region on that. India also has a reusable pad standard. And so again, we have to bring that learning to the table. Otherwise, we would be remiss. In terms of how these countries are contributing to the global effort, so 23 members of ISO TC 338 already have standards, of which 16 are LMICs. So we already have a lot of that expertise on the table, but we still need to bring more. Bangladesh and Pakistan are the only countries that have standards for single-use pads, and Bangladesh also has for multiple-use pads, but they are not yet engaged in ISO TC 338. So I would urge specifically, if you're working in either of these countries, to get in touch with your NSP. In terms of enforcement, so it's important to understand that just having a standard is not enough. Enforcing it is also important. So standards in Egypt, India, Nigeria, and Uganda are all mandatory, but usually they've had to be made mandatory through a separate reform or an order. And so that requires a next level of advocacy effort as well, and that one could start working on already. Which which other ministries need to be engaged to work on that, and so on and so forth. In high-income countries, typically we've seen that standards are embedded within broader norms for market introduction, so they don't necessarily have this kind of an enforcement requirement. Some insights on standardization parameters that we've seen. So almost all standards actually have physical parameters, so like size, thickness, and a variety of things, but these vary widely. So there's definitely need for harmonizing this parameter. It's difficult to do because the acceptability of different design sizes and all, it varies by country. But then physical safety can definitely be harmonized. Then performance parameters are moderately defined, but there is a huge variation across, even starting from what parameter is used. So absorbency, whether it's re-wet, absorbency, and ability to withstand pressure. There's different types of technical parameters that are used across. Test methods that are used vary. Liquids that are used in those test methods vary. Limit values, so the higher end of absorbency ranges from 10 ml to 30 ml, which is a huge variation. For tampons, there is some harmonization, that there is one method that's usually used, which is the Syngina method. For multiple use pads, color fastness is also typically now included as an additional parameter in some standards. Again, pH is one parameter that exists in almost all standards. However, the range is very wide. 3.5 to 8.5 is, the range of limits values that we found. That's from acidic to alkaline. So that's something that also needs harmonization. In terms of microbiological parameters, almost all have this requirement. However, what is the parameter that's included, whether it's total microbial count or it's a specific kind of count, that varies. For externally used products, typically the limit for total microbial count is 1000 CFU per gram, and for internally used product is between 100 to 500 CFU per gram. So there is some level of harmonization that exists there. But different standards also call for absence of specific pathogens, and that also varies, requiring that harmonization is needed. In terms of material safety, again, this is an area that some standards address, not all. But the way they address it is very different. Some include certain chemicals of concern. Some refer to global lists like the EU REACH list or the EU regulation for cosmetics. Some, like Ethiopia, have actually regulated certain heavy metals like lead, cadmium, mercury. Some include biocompatibility testing as per ISO 10993. But even within that, which tests are included is highly variable. So there's a huge need for harmonization on this area, because this is where a lot of studies come out, and we don't know what is in our products. So material safety is definitely one area that needs harmonization. So these are most of the things that we are seeing across standards that we could sort of take as analysis by looking at the standards in one place. But the key takeaway for us is that technical harmonization across all of these parameters is definitely needed. We need expertise, so we need microbiologists, we need material safety experts who are working in country to come and participate in ISO TC33 and provide that input, because these discussions are happening right now, as Yara had mentioned, and we need as much technical input as we can get. So please contribute to global standards for menstrual products today, and you will be shaping the market for decades to come. And with that, I just want to close on the database website, saying that it'll be coming soon. RHSC is working hard on developing the website. And you will have different types of views. It will allow you to, have some sort of comparison across different standards. So you can look at what exists, what needs to be addressed in terms of gaps, etc. But this is coming soon. And with that, we come to the end of our presentation. I know we are above time, but if there are any other questions on this, we are happy to take that, maybe take one question, but otherwise, I'll hand it back to Sarah and the team at RHSC with a huge thank you for giving us the opportunity to work on this project. It has been a huge learning experience for us. Thank you.
Thank you so much, Tanya, and thank you to Arundhati, Samya, and all of our other wonderful speakers today. I know we are a bit over on time, but I think it was well worth staying an extra 10 minutes to make sure that we got all of this excellent content. For most of the questions that have been put in the chat, we have responded to those directly in the chat. We will, after the webinar, take some time to go through, and if there's any questions that didn't get an answer, we'll definitely work with the team at Menstrual Health Action for Impact to make sure that we can send some answers through to everybody. So just in conclusion, this was the second of 4 webinars in our Developing Equitable Markets for Menstrual Health Supplies series. Our next webinar is 2 weeks from today, and that webinar will look at the work that we've been doing on the intersection between climate change and menstrual health supply chains, thinking both about how to adjust supply chains to be more resilient to climate change, and then also thinking about the way that supply chains contribute to climate change. And then 2 weeks later, we will have a presentation looking at the affordability challenge of menstrual health products. So really trying to think through what is driving the cost of menstrual health products, and how might we leverage things like tax reform to improve affordability, and not just to improve affordability for some people, but for all, to really bring in that equity lens. So following today's session, we'll be sure to send out the recording from today. If you know people that were interested in accessing the webinar and weren't here, you're welcome to share that recording with them. And then in the coming days, we will also be sharing the climate-related deliverables so that you have those ahead of the session on 2nd June. And I just want to say a tremendous thank you for our colleagues at MHAi for the excellent work in developing this advocacy toolkit. I know it will be an incredible resource, not only for encouraging the adoption of standards, but really for enforcing those standards, participating in ISO, and making sure that we have global alignment on how to both adopt and scale those standards internationally. Thank you so much, Tanya, Arundhati, and Samya, and we look forward to seeing you all in our next session. Have a great rest of the day, everybody.